This 3-year-old standardbred trotter has concurrent left hind limb and right forelimb lameness. Concurrent diagonal lameness causes an unusual gait resulting in a rocking type gait or motion. In the previous video segment, we showed a horse with concurrent ipsilateral hind limb and forelimb lameness, in which head and neck nod from both components was predictably similar. However, in contrast, in this segment, the horse has left hind limb lameness and right forelimb lameness, causing a paradoxical head and neck nod. Notice the pelvic hike up when the left hind limb hits the ground and drifting to the right. The expected head and neck nod with left hind limb lameness would be a nod down when the right forelimb hits the ground. However, in this horse, a head and neck nod down is seen when the left forelimb hits the ground, indicating the presence of right forelimb lameness. From the side, a shortened cranial phase of the stride in the left hind limb and a pelvic hike up when the left hind limb hits the ground indicate left hind limb lameness. Using the windows behind the horse, notice the head and neck nod down when the left forelimb hits the ground. After low plantar diagnostic analgesia in the left hind limb, there is near complete resolution of left hind limb lameness. Pelvic hike and drifting are nearly completely abolished, but head and neck nod consistent with right forelimb lameness is still present and in fact more obvious than before the left hind limb block. When examining a horse with concurrent forelimb and hind limb lameness, I usually attempt to abolish the hind limb component first using diagnostic analgesia, whether concurrent lameness is ipsilateral or diagonal. Diagonal lameness is common in the trotter. Once again, using the windows behind the horse as a frame of reference, notice prominent right forelimb lameness now, more evident after low plantar analgesia was performed, to abolish the initial left hind limb lameness.